study causing major concern about the use of folic acid in B12 supplements. Pregnant women are often told to take folic acid to reduce birth defects in their babies. B12 supplements are known to give you an energy boost throughout the day, but now researchers are saying that they can give you cancer. Here to talk more about this study is Dr. Mark Trolice. Thank you so much for joining us today.
My pleasure, Heidi.
You deal at your clinic, infertility specialty, with women all the time trying to get pregnant. I'm sure one of the first things you tell them is to start taking folic acid.
Absolutely. We've known for years that folic acid can help reduce neural tube defects, which are like spina bifida, a problem with fusion of the spinal cord and the skin, as well as cleft palate. And they should be taking that probably around 2 to 3 months before trying to conceive.
Okay, so this new study, I've heard a lot of people getting scared and thinking, oh my gosh, do I stop taking it? Do I need to talk to my doctor? Is there concern here that it's going to cause cancer down the road?
Well, I think there's a lot of reassuring data that's coming out. Women should start taking it before they're trying to conceive, and then probably up until the trimester, and then they continue thereafter. Shouldn't be harmful. But this study was following men and women with heart disease in Norway for up to 6.5-year follow-up. And what happened is that they were giving them much higher doses than what women would be trying to have right now with pregnancy, and also for a longer duration of time. There was a higher association with cancer and all-cause mortality. But you know, the interesting thing, Heidi, is that since 1998, when the U.S. government mandated fortifying foods with folic acid, the incidence of cancer and lung cancer in women had gone down since then. So there is conflicting data on whether folic acid will even prevent cancer, and this study suggests that it might increase it, but I think the bottom line is that for women who are wanting to conceive, folic acid, absolutely. And if you're not trying to conceive, and if your folic acid is not low, then there may not be any reason to be on it.
Real quickly, we have to touch on this because it was in the study, the B12. A lot of people are taking it as supplements for energy right now. Did it have any concern there, too, that it's something you want to stop if you're taking?
Well, they combined several different treatment arms with this study. They had folic acid with B12, folic acid with B6, or placebo, and they really didn't distinguish whether B12 was the issue at all. It's hard to say right now from the data of whether B12 is going to be a problem. It seemed like the focus was on the folic acid.
Okay, but bottom line, you're going to tell your patients, keep taking the folic acid.
Oh, absolutely. This is essential to ensure the reduction of spina bifida, neural tube defects, and this has been shown over and over again.
Dr. Mark Trolice, thank you so much for joining us today and clearing up some of the confusion on this study.
My pleasure, Heidi.
Thank you so much. Trolice, over to you.
All right, thanks, Heidi. This morning, a look at the story.